So our first speaker is Kate Agha. She's the CEO and co-founder of Oxford Against Cutting, and she will be presenting on FGM in schools.
Thanks, Elizabeth. I'm just going to share my slides now. Excellent. So I just wanted to ask you to start off, have you ever been at home as a parent or an aunt or an uncle and heard a young child, say 7 or 8, suddenly come up with a question like, what does sex mean, mummy? And it's usually when you're doing something else, like, I don't know, filling in a form or trying to make the dinner or something, and it catches you completely unawares. But when children ask these kinds of questions, then they're ready to have some kind of answer, and it can be really tricky. But the good news is that when it comes to talking about female genital mutilation in the school environment, we can prepare and we can make sure that we're ready with sensitive and age-appropriate information. So that's what I'm going to be talking about, is talking about FGM in schools. And hopefully it will be helpful also for groups working with young people. Okay, so I'm going to be talking about FGM in schools. So Oxford Against Cutting has been running for about 8 years. And the reason why this is our specialist area is that we deliver workshops for some 2,000 teachers, students and professionals every year. And so I'm going to cover 4 areas. So the different ages and age-appropriate material, who should be facilitating these lessons, materials, so which materials kind of make the best impact, and then what the government can do. So before teachers talk about FGM in the classroom, it's obviously really important that they know what they're talking about and that they have specialist safeguarding anti-FGM training. And we would recommend that training for the whole staff team. So include your receptionists, include your lunch team, include your PE teachers, include everybody, because you never know who it is within the school community who is going to be able to spot warning signs and indicators. So that's your first step. And then once you're ready to talk to students, obviously you need to think about age groups and materials. So in terms of primary school level, FGM isn't a mandatory subject. However, schools do have to cover healthy and unhealthy relationships, including harm and sexual harm. So what we did in our charity is we created a lesson plan and film called Who Can You Tell, which is designed for year 2 students. So for those of you who aren't familiar with the different year groups, that's 6 and 7-year-olds. So we don't talk about FGM specifically, but we do cover sexual harm. So we cover the PANTS campaign, and you can probably see hopefully you can see the PANTS image there with the acronym for PANTS. We cover secrets that can upset children and trusted adults. And then our film has a girl from an African community talking to a blue rabbit about a friend that she's worried about. And we chose the blue rabbit because a rabbit is considered wise in some African communities. So by the time you get to year 6, students are quite often mature enough, well, maybe mature enough to talk about FGM. But it really depends on the individual school. And I think, the things for schools to think about are the maturity of the students and the demographics. So even if you have one child from an FGM affected community in your classroom, it may be that bringing that learning in will help that child reach support, will help that child if she's at risk. And keeping in mind as well that children generally talk to children. I mean, they may talk to a trusted adult, but they may talk to a friend or a peer about something they're worried about. So we've created a lesson called FGM Culture and Human Rights, which is designed for year 6 students. And so for those of you not familiar, that's age groups 10 and 11. And in that lesson, we do say what FGM is. So there's a definition, it's very basic, where we'll talk about FGM being an injury or a harm to the place between a girl's legs. And we'll talk about the law and say it's illegal and that it's a cultural harm. But as well as talking about harm and FGM being a harmful practice, we also talk about positive and non-harmful cultural practices. So we introduce the session with learning on festivals and cuisine and the lovely parts of different cultures, before we will then address the harmful practice. And we always encourage young people as much as we can to become young activists. So we mentioned some activists working in other areas, such as Malala and Greta, who the young people will hopefully relate to. And even if FGM isn't their specific area of activism they want to go into later, it may be that the lesson in itself will encourage people to join charity work and activist activities. So at the secondary school level, FGM is mandatory. And again, schools will be reflecting on which year group to introduce the subject. So the factors to consider are, again, maturity levels. And one of the things that we've noticed in our facilitation team is that the maturity levels have dropped a little bit during the pandemic. So a year 7 student pre-pandemic was actually seemed to be slightly more mature in some schools than post-pandemic, because those students would have missed most of year 6 and the opportunity to do some RSE and socialising with peers. So consider maturity levels, consider your demographics, and consider the age. So by the time you get to secondary school, the chances are we're much more likely to be talking about survivors of FGM than girls at risk, because most FGM is happening between 0 and 5 or primary school level. But also, again, keep in mind that children do talk to other children, and some groups say, including the National FGM Centre, say let's talk to children at an early stage, so year 7, so that they're ready to know where to get help. So at year 7, we are talking in a little bit more detail. So we're not talking about the types of FGM, but we are talking about FGM as a cut. But we often get kind of questions. So you'll give the information, and then there'll be some curious minds, and you might have a question of what exactly happens, or what are the different types if somebody's heard of FGM before. And in those scenarios, you need to obviously manage the whole group. So not all children will be ready for the answer. So what we would do is we always facilitate in pairs. So one of the facilitators may answer the question next to that student and check with the neighbouring students that they want to hear the answer as well. So at 6th form, you can speak more openly. So you can speak about female genitalia and sexual pleasure and types. And we link our FGM learning to female cosmetic genital surgery and body image. And the reason we do this is that we feel that by including all of the learning, it reaches everybody in the classroom. So if somebody doesn't necessarily relate to or understand FGM, chances are they would have heard of design of vaginas or labiaplasty in the media, and we can draw parallels on some of the reasons and the law around the practices. So facilitators, so this is some of our lovely anti-FGM facilitation team. So my core message really is always deliver anti-FGM training with somebody from an FGM affected community, and preferably somebody representing the communities in your area. Sorry. So we have a number of survivors in our team, or people with first-hand experience of how the practice affects families and communities. And this is what makes our training really powerful and our lessons powerful. The other way that you can create powerful learning is by including young people for a peer education. So, for example, we have somebody, a young champion in our team who we started working with when she was 12. She joined some of our arts projects, and she's now 20, and she's now a trustee, and she's delivered lessons to her peer groups throughout the years, and that's really powerful. So obviously, when you're talking to young people, it's really important that your material is engaging and it's interactive. And what we say is don't just kind of think in the box and think, you know, FGM must fall within PSHE. It could fall within your art lessons or sport. And I've included some pictures here of some of the projects we've run. So there's a piece of artwork from some honour-based abuse art activities, and there's the football team that we worked with in East Oxford. So we ran a project where the boys would learn about FGM both on the pitch and off the pitch. So we'd do a workshop, and then we'd go out with the coaches, and then they would shout sort of words when they were playing that would embed learning, like instead of goal, it would be end FGM. And this was a project that we modelled on a Cricket Without Borders project, and it worked really well. So yeah, so if you're in the classroom, use film, use quizzes, get children moving intellectually and also physically if you can, and always end on a positive. So we do have to talk about FGM, and it's harmful and it's upsetting. And what we'd say though is we want to leave children and anybody really that you're talking to with the feeling that they're not hopeless, that they can make a difference for other people and future generations. So always end on a positive. We want young people to become activists, as I said before, so they can educate the public and they can create materials, for example, posters. So yeah, so our model of working, talking about FGM in the classroom and then running an art workshop sort of a week later really works well in terms of embedding learning. Thank you. So what can the UK government do? So I've included in this slide a picture of roses, because roses are symbolic of female genitalia, and lots of NGOs use them who are tackling FGM. So my core message really is fund and support NGOs, particularly around specialist anti-FGM education, because the price is really high if we get this wrong. We've worked with a school, for example, who came to us after they delivered lessons for year 8 on FGM, and they showed a film, and the film was talking about a girl being cut or she was being held down, and it really traumatized and maybe re-traumatized some of the survivors in the classroom. And that's obviously not going to be helpful in terms of getting messaging across and learning. So it's absolutely vital that it's age appropriate and sensitive information. The second reason for NGOs and specialists working in this area is because they work with people from affected communities, or are led by people from affected communities. They're linked in with local services. They know about local communities and local practices. And then the other thing just to say is, you know, PSHE teachers, they obviously have a lot of different subjects to cover. I think FGM is at the very top of the list in terms of sensitivity, and I don't think it's really comparable, for example, to say bullying, because quite often with FGM you have to talk about sex, you have to talk about race, you have to talk about sexual pleasure, you need to understand the community dynamics. There's a lot in talking about FGM. So just a quick recap then in terms of learning. These are my only words. Don't just talk about FGM. If you can, talk about culture, talk about female cosmetic genital surgery, talk about art, link it in with activism. Talk to everyone in the classroom, use art and sport. I've said enough about that. Engage local communities. And then finally, please support your local schools. And we offer workshops for schools, abuse practitioners, police, social care workers. So if anybody wants to get in touch with us to book workshops, we'll be really happy to run those for you. And yeah, I guess my final message is let's work together with people from affected communities and ensure that people with lived experience and from affected communities are at the core of everything that we're doing. And that's my presentation. Thank you.